Hello and welcome, members of Foggy Bottom West End Village. My name is Justin Mule, and I'm a student physical therapist at the George Washington University. My colleagues and I have been tasked with creating a series of educational resources for those who are interested that want to get a little bit more insight onto the different aspects of fall prevention and falls. So for this video that I'll be walking with you through, we're going to talk about balance. And let's get started. So before we get into any of the information about balance and how it influences falls, we've written up some objectives that we're hoping by the end of this presentation, you'll be able to have a discussion about what balance is and why it's important, that you can understand how balance influences fall prevention and its risk, and that you can explore different ways to improve your balance and how you can get started on that. So first, we're going to talk about the fundamentals of balance, and this will go over topics including what is balance, types of balance control, and then different movement strategies that your body incorporates to help maintain your balance. So let's talk about what is balance. Balance is the coordination and organization of movement with sensory information to keep the body close to its core center of gravity. And we all have a core center of gravity, otherwise known as a core center of mass, that sits slightly below our belly button. And our body wants to make sure that we stay within that center of mass, otherwise we may lose our balance. And this is done by collecting sensory information, which is a combination of visual, so using our vision, vestibular, which is a functional word for our inner ear, and somatosensory, which is a fancy term for general sensation of your limbs and extremities and body. And this is all done to assess the position and motion of the body in space. And then it also utilizes the execution of muscles to control the body's position within the surrounding and environment for the current task. While sensation and muscular control help maintain balance, it needs to be able to do that in a variety of settings, in a variety of ways. And this brings us to the different types of balance control. So there's static balance, which is the ability to maintain a position at rest. And this, for example, you could be doing right now, either sitting or standing where you are watching this video. And then there's also dynamic balance, which is the ability to keep a stable position while the body is moving or the surface is moving. And this, for example, could be if you're walking on the sidewalk or you're walking on a treadmill. And our body needs to be able to adapt to these different types of balance control scenarios in order for us to maintain that balance. Otherwise, and we'll get into this in the next slide, our body goes through a series of different strategies to maintain that balance. Otherwise, we may trip and fall. At the end of the previous slide, I mentioned how our body undergoes certain movement strategies for balance control. And this is done in order for us to maintain our balance, especially if we're about to fall or we feel like we're off balance. And this is done almost in a series, starting at your ankles and then moving up your body until we have to step. Starting at the ankle, we have to move back or forth depending on the direction of how our body is moving or being pushed outside of its center of gravity that I mentioned before. And this helps to make sure that we keep that center of gravity within a so-called base of support. Okay, and then we move on to weight shift strategy. This is more so if we're being pushed or moved outside of our center of gravity from moving side to side. And this is if we're shifting our weight from the left or from the right to make sure we keep that center of gravity within a base of support. Next, we have suspension strategy. And the suspension strategy can be seen if we have loss of balance and we want to move ourselves closer to the ground. We can see ourselves bending our knees, bending at the ankles, getting ourselves lower so that we keep that center of gravity, that center of mass within our base of support. Next, we have hip strategy, and this can be seen if we're leaning backwards or forwards at the trunk or the stomach, the abdomen, to make sure that we are keeping that, again, that center of mass within that base of support. 5, the stepping strategy is the very last option that our body undertakes in order for it to maintain our balance. And for the stepping strategy, if all else fails, we take a step. So if we feel that we're leaning too far forward, leaning too far backwards, we may take a step to help make sure that we're staying within that base of support and keeping that center of gravity close. And this can all be done in a combined strategy. So our body may not always use one strategy in isolation. It may combine everything and use multiple. And that's a good thing because that means our body's making sure that everything is utilized whenever possible. And especially if we're out in the world, we may not be able to use only one and isolate those strategies. So we're going to have to use a combination of. Now that we've talked about what balance is and the fundamentals of balance, we can talk about why balance is important and how it influences almost every aspect of our lives. Balance and coordination play such a huge role in our everyday lives, especially when performing our everyday activities. It can help prevent falls. It can improve the ability to perform those everyday activities and therefore improve our quality of life. It acts as a key component of any workout routine, such as it helps to challenge the body in a new way, thinking of yoga or Tai Chi. And then balance exercises can be done almost anywhere, even right now in your own home. And finally, it can slow down the negative effects of aging that we naturally have occurring on balance and coordination. But how does balance influence fall risk and prevention? So on the bottom left of the slide, you can see an image detailing the cycle of falling. And this describes different events that can eventually lead to a fall if we let them continue. So such as if you are inactive, and then may lead to a decrease in muscle strength, and then that may lead to an imbalance in gait. And gait is just a fancy word for walking pattern. And if you have poor walking, that can increase the risk of you falling and thereby leading to a fall. But our goal is to reduce or stop and counteract any of these events that could lead to a fall by improving our balance. And over on the right side of the slide, you can see an image detailing different tips for us to improve our balance and help prevent falls. So you can use an assistive device like a cane or walker. You can stand up slowly to avoid dizziness. You can have a conversation with your healthcare provider, especially about medication side effects. You can do strength and balance exercises, or put different things in your home to help facilitate better and more safe environments. Since we talked about the cycle of falling and different ways to help prevent falls on the previous slide, let's get into fall risks. So some examples of fall risks include balance or walking problems due to vision or vestibular, that being inner ear, impairments. Things like multiple medications and their possible side effects, especially those you may not be aware of or your doctor hasn't fully explained. Tripping hazards, especially those around the house or outside, maybe on the sidewalk. Joint instability, if we have weak musculature, then we may not be able to withstand different movements, especially in load or weight bearing joints, such as the knees, hips, or ankles. If we have lower body weakness, again, that is similar to joint instability with weak muscles. And that's where strength comes in. Or we can have foot pain or poor footwear. If we have foot pain, then we may be more likely to change our gait or our walking pattern, which could lead to uh, an increased likelihood of falling. Or if we have poor footwear, like flip flops or sandals, in an environment that requires something more versatile or more mobile, then we may be more likely to fall. While we talked about different fall risks, we also want to discuss the different things that we can do to reduce those risks. And these can be found in a multi-component exercise program. And by multi-component, I simply mean things that challenge our strength, things that challenge our flexibility, things that challenge our balance. And some benefits of these are increased reaction time, especially if we trip over something over the sidewalk. We may be able to take that step, use that stepping strategy to catch ourselves. It can lead to improved coordination, enhanced facilitation of muscles for balance control. So some of the strength training that we may implement can improve weakness in the lower body or joint instability, which we talked about was a risk in the previous slide. It can improve brain function, reduce stress or anxiety, and increase the ability to perform our daily tasks. There are many benefits of a multi-component exercise program that help reduce the risk of falls. But what can we actually do to improve our balance? The best way to improve our balance is by putting it to the test. And this can be done in many ways, such as physical therapy, especially after bouts of vertigo, stroke, or the onset of Parkinson's disease. A great way to improve our balance is through balance exercise programs that test our system and push it outside of the norm in order for it to adapt and become stronger. And this can be done through Tai Chi, yoga, or Pilates, which I know Foggy Bottom West End is very good at implementing those throughout the year. Things like diet or lifestyle changes are huge factors that we may not even consider. If we're overweight, that can put our center of gravity or our center of mass more closer to being outside of the base of support, leading to greater instability or more frequent loss of balance. Things like hydration. If we're not hydrated enough, we may become dizzy and lose our balance. Things like more protein in our diet, especially with strength training. We need to be able to develop muscles that are going to be strong enough to hold us up and maintain our balance if it is challenged. Finally, we have our references listed here. If you have any questions or if you want to take a deeper dive into this topic, feel free to click on the links at the end of this PowerPoint if it's available. If it's not and you're unable to click the links, please go ahead and type in balance, then Physiopedia, or balance, then American Heart Association, and you'll be able to come upon the sources that we utilized for this PowerPoint, as well as many other great sources from reputable organizations. So from my colleagues Kellen and Sarah and I, thank you for letting us do this video for you, and we hope that you gathered some useful information from it.